Welcome, Nora. Thank you so much.
Happy to be here.
It's 8:04. We'll get started. I appreciate you.
Of course. Do we need to give folks any more time to get on, or do you want to go ahead and go since you're going to record it for folks that aren't here?
Yeah, let's go ahead. We have some people on, so let's go ahead and record it.
Okay.
I'm recording.
Okay.
Good morning, everyone.
Morning.
Nora, thank you for doing this.
I'm happy to do it. I'll see you. Just let me know when y'all are ready for me to get started, and I'll move into the material.
Okay. So most of us know who Nora is. She is the executive director of the Texas eHealth Alliance, the nonprofit advocacy group. I just stole this from her website that she started almost 10 years ago to give health information technology folks a voice in public policy. We know her as she is very generous with her time and resources during legislative sessions, and she gives courtesy emails and summaries to HIMSS chapters during our legislative sessions. We enjoy all of the information and to the level of detail that she provides, and also some of her wonderful humor as well. It helps us to understand what's going on. And we've asked her to do this, how to advocate like a Texan, because one of the things I took back when I had lunch with Nora, when Sarah and I had lunch, is that HIMSS Global is an amazing resource and they provide such a wonderful platform to us, but we need to learn how to funnel that to specific Texas-related issues if we want to be effective. And so ask Nora, because of the timing and before she gets crazy because it's post-election, to help us learn about what it takes to be impactful with our legislators when we do our walks and when we do our talks and communicate with them. So with that, I'm going to let Nora take it over.
Great. Thanks, Elsie. Good morning, everybody. Happy to be here. What I've done is I've put together some sort of sequential tips for having a successful visit day at the Texas Capitol. I am a person that used to be the recipient of those visits and have observed them for a long time. And so this is obviously my personal editorial opinion, but I've been in the business 25 years and I feel like I have a pretty good grip on what works and what doesn't. For those of y'all that don't know me, I've been in public policy, working on health IT forever, including at Medicaid. I also have a background as a programmer, so I really am a nerd and delighted to be in the kind of the glorious era of nerd culture that we're in. Our association is a 501c6, so I can't discuss specific products or vendors or companies. We work on public policy, and that's sort of how that goes down. So Elsie, are the slides advancing properly? Have we at least resolved our technical issue?
It did not advance.
They did not advance at all?
No, I still have your main slide.
Okay, let's try this. Let me know if you see something new.
No.
How about now?
Mm-hmm. No. Feel like an edit.
How about now?
Nope.
Well, I've tried it. I've tried it in every way.
So click on your thumbnails, maybe, because that's what we're seeing is the thumbnails on the left and your slides. So maybe just go click on your thumbnails. Yeah, I can see your mouse now.
Okay.
And actually,
so can you see
so
my
just go
slide?
I can see your slide, the first one. So
okay.
you may have to click on the thumbnail part to make it advance.
Okay, I am on the thumbnail part. I've gone to the second slide in the thumbnail.
And it still has your first one highlighted. Dang it.
I got nothing. Here.
Sorry, guys. Do you want can you send them to me real quick, and I'll be quicker?
I sure can. That was exactly, you read my mind. Sorry for the technical glitch, y'all.
Sorry, guys.
I don't know why.
Yeah, I tested it last night. Yeah.
I have a brand new machine, so goodness knows what its problem is. Hang on. One other thing I thought, maybe I should try sharing my whole screen instead of just the app.
Okay.
Want to try it out?
Yeah.
Okay. Hand it back to me. Make me the presenter one more time. And let's try my entire screen.
There you go.
How about now?
That's working. Yes.
How about now?
Perfect.
Background slide? Hallelujah.
Yes.
Okay. It did not like just sharing the app, so that's good to know. So let me flip forward to the abstract. So just, I believe in effective advocacy. Advocacy is important. You really have to look at people's home districts, and so that's kind of my goal this morning, is to talk to you a little bit about how to be effective. You should now be seeing a slide with a bar graph on it.
Yes.
While this is a perfect, yes. So this is a slide from Washington that it translates to Texas just as well. Form letters are not nearly as useful as individual constituent visits, and so they surveyed congressional offices and they said, hey, what is the thing that is the most likely to sway your position? Constituent visits, individualized letters and emails, lobbyist visits, individual faxes, phone calls, and then you can see that the form step drops off pretty fast in terms of impact. So this is the outline that I'm going to use this morning. These are the 6 questions that you need to ask yourselves before you have your Hill Day. And we're going to go over each one of them individually, and then I'm happy to take questions either while we talk or sort of at the end. The design here is to get you to be thoughtful about your messaging before you go, and then prepare you, give you some tips about what not to do, and then how to follow up. So let's start with, why am I going? It is amazing to me sometimes to hear people say, well, we always do a Hill Day. That's nice. What are you doing with your Hill Day? So you have to spend some time sort of thinking about, what is the goal in mind? Are you wanting to influence legislation? Are you just wanting to let legislators know that you're available as a resource if they have questions? Is there a new law you want to advocate for? Is there an old law that you think needs to be gotten rid of? Is the other side showing up? This is also really, really important. You would be surprised at how controversial something as simple as sharing information about a patient can be with some of the stakeholders. So you have to spend some time thinking about, are we on the offensive? Are we pushing and fighting for a change or a provision? Or are we here to say, this is important to us, don't change it? So don't underestimate the power of defense. I think sometimes people get very caught up in the glamour of, we're going to pass a bill, we're going to pass a bill. Keeping good provisions in the law is just as important sometimes as creating change. The number one question yes, go ahead. That sounded like a question. Nope. Okay. The number one question, particularly legislative staffers are going to ask you is anything you're asking them for going to cost money? And boy, if you have something that's specific enough that it might cost money, you need to have answers for that before you go in the door. That is really, really, really important, because then it'll look like you haven't done your homework if you don't know if there's a cost to what you're asking for. And this is, of course, about to shift because we're going into session. Where are you in the legislative cycle? We're off for 18 months. We're in for 6. They don't have any legislation on the floor for the first 60 days. You need to know where you are so that you can talk contextually about, well, we have a bill that's been filed, or we're waiting for a bill to be filed, or we haven't had a hearing, we have had a hearing. If you're talking about a specific piece of legislation, you need to know where it is, you need to know where you are in the legislative cycle. So this sort of pre-planning is really, really important to do. Know why you're going. And it can be more than one reason. You don't have to pick one. That's okay. But be purposeful. Yeah. Okay. So once you figure out why you're going, then you have to think about what you're going to say. This is really, really, really important. Number one is you have to pick your battle. The digital health universe that we work in is massive. You've got cybersecurity, you've got privacy, you've got the opioid epidemic, you've got telemedicine and telehealth, remote patient monitoring. You have to sort of pick the 2 or 3 things you think are most important, identify what those messages are, and summarize. For example, if the HIMSS chapters feel like the state could do a better job empowering providers to share protected health information, that's a pretty good message. Then you need to know what you're asking the legislature to do in order to make that better, and you need to be able to explain why it's important to patients. You have to frame the discussion around a specific problem and a proposed solution. So my dad was an engineer, and I was not allowed to complain about anything without bringing him a proposed solution. So a lot of the time, if you tell them, oh, there's a problem, for example, we're having trouble sharing data, if they're not an expert in healthcare, they're going to say, well, what do you want me to do about it? And so if you're going to point out specific problems, you need to be thinking about solutions, or you need to say, you know, we're not really sure exactly what the answer is, but we would love to work with your office to figure it out, or if there are other people we should talk to, we'd like to know that too. So it's okay to not have like a bill, to walk in with pre-drafted language, but one of the things that really frustrates legislators and staffers is when people come in with concerns, but then don't offer any solutions. Because a legislative office has to look at all of government. They have to look at higher education, public safety, criminal justice, healthcare, school finance, things for their district. And so the best way to help them is to be specific. And then the other thing that's really important is make it personal to their district. So what does that mean? How does it impact their district? They may ask you, well, what does this mean for my constituents? How does this translate to the folks at home? That's why I believe it's really important to try to match the people that are doing the visiting with the districts whenever you can, particularly if they are people that work and live in that district. So kind of sticking with this example of we want to improve data sharing, an example from the local hospital, or saying, you know, our hospital sees X number of patients a year, but we also refer out Y number of patients. The patients that get referred out, it's important their data goes with them, so the care team at their new facility is not starting from scratch. You have to give it a little local color, and that helps them grip onto the issue a little better than it just being abstract. And that's why the pre-visit work is so important. Figuring out what your messaging is, and then figuring out how to make it personal to the legislators. I know organizations that will break down like the number of people employed in the biotech sector in each legislative district. You don't have to go that far, but it does help. And this is where I think HIMSS really has some strength. We have health IT professionals in every district, pretty much, except for maybe Hudspeth County where there are cows. There might be a couple counties where we primarily have cows, but we have people working in this space all across the state. So if you can, to the extent that you can match local people to local legislators, you have to remember that local person is also a voter. Legislators care very much what the people in their district who love voting think about issues. Does that make sense? So frame up your messaging, frame up your delivery. That's your pre-planning. So you got to start in advance. But I'm not done pre-planning. There's one more step, and that's how to get ready. And this is another place where I feel sometimes in the rush to get these things done, people don't do this kind of digging. And as a leadership team, those of y'all on the phone, once you start with the why are you going and you decide what your messages are going to be, there really is a third step. And that third step is you had better be up to speed on the topic. You've got to be tracking not just what's going on at the state level, but what's going on at the national level. If I think you guys are going in February. So
mid-January.
Mid-January. So mid-January, there won't have been legislative hearings, but there might have been an interim hearing. For example, if you're going to make the opioid crisis a talking point, we have had several interim hearings on the opioid crisis, and I've testified in them. So you sort of have to know, what are people talking about? What are they asking about? There will be, the good news is, between now and when you guys do your visit, the committees are going to issue interim reports, and a lot of the topics that I suspect that you guys care about are going to be the subject of interim reports from the committee chairman, and I'll make sure y'all get copies of all those when they get released. So you sort of have to know contextually, where is the topic in the legislative process? Is it something people are studying? Is it something people are talking about? Pros and cons. Was there a bill last session? This is a place where you can really get tripped up. So I'm trying to think of something from last session that didn't pass. There was a bill to improve access to mental health records in a crisis, to allow that, you know how we have break the glass for emergencies? They wanted to add like school shootings and mass shooting perpetrators to that break the glass, and it all goes back to the shooter in Aurora, Colorado, and kind of a dispute about access to his medical records. So that bill got filed last session, and it died in calendars. It didn't make it over to the Senate. If that was a topic that, and I'm not recommending this topic, actually, I'm just using it for illustration purposes, you would need to know there was a bill about this last session, and it got out of House committee and it died on the floor. You may, as an advocacy organization, want to be higher level than that. You may not want to get down that deep, but if you do, then you've got to look at last session and kind of look at the history. So that piece of it's important, number one. Number two, what is the members' voting record? And this is one where I know some people got tripped up last cycle. The voting record and their opinion are not the same. So I know there were some folks that went to visit one of the physician legislators who had been having a hard time either with his EHR, his e-prescribing module, and he just ranted and ranted and ranted about his frustration. Completely fair for him to rant about. However, his voting record is consistently pro-health IT. He carried a telepharmacy bill. He voted for the telemedicine bill. So he's a critic and a skeptic personally, but he votes in a way that is good for the industry. So it is important, both in the run-up to the visit and in the context of being in the visit, to separate those things. Most bills, unless they're on a hot-button topic like abortion, don't have a lot of folks voting against them. So if you are looking at a topic and you're looking at votes and you see, oh, well, so-and-so consistently votes against this sort of bill, you know, I'm a person y'all can call to say, why? Why does this guy always vote against this stuff? And sometimes the answer is going to be as simple as, he's in the Freedom Caucus, he hates everything. Sometimes it's that simple. And sometimes it's, oh, he had a bad experience with the bill in the 09 session. There's no way for y'all to know that stuff. That's what I'm here for. Just be mindful that what they might say in the visit, or what the staff might say in the visit, and we're going to talk about this some more in a few minutes, is not necessarily going to be the same as their voting record. Again, you have to know if there are people on the other side of the issue from you. And I think it's important to sort of delineate serious opposition and non-serious opposition. For example, our colleagues at the Texas Medical Association and the American Medical Association frequently take a different position on things like data sharing from those of us in the health IT professional space. The Texas Medical Association is incredibly powerful. So if you want to go talk to legislators about a topic where you know the doctors don't like it or they're uncomfortable, there's nothing wrong with that. You just have to be prepared to say, oh, they're going to ask you, who doesn't like this? That's a very standard question in a legislative visit. And there's not a saying, unless you invoke Godwin's law, which has to do with bringing Nazi Germany into the discussion. Almost every bill has somebody that doesn't like something about it. Now, it might be a fringe group, it might be the Scientologists, but even though things pass with consensus, it's very, very rare to have something that is such a brilliant, wonderful, gorgeous, sparkly idea that absolutely nobody hates it. They'll be very cynical. You won't seem credible if you assert that you're advocating for an idea that everybody loves, because that's just not, again, unless you're invoking Nazi Germany, generally not the way that works. And again, contextually, looking at their district, looking at their voters, I'll give you a really good example of that. Representative Sarah Davis from Houston, who just got reelected, represents more physicians and medical professionals than anyone else in the legislature. Because of her district, she is generally more up to speed on some of this stuff than other legislators, and that's good, but she might also ask more specific questions, and her staff might ask more specific questions because it reflects her district. A rural legislator from West Texas, for example, Chairman Price, who chairs public health, is more likely to say, well, what about broadband, and what about my rural constituents? And all this computer stuff is great, but how are you going to make sure that all my constituents in rural West Texas can get the benefits? So contextualizing each legislator is important. Now, we have a bunch of new legislators. There's not going to be a bunch of information available on all of them, and that's okay. But for the ones that are the chairmen, committee chairs, sort of the leaders on this stuff, if you want to have an impact, you've got to prepare in advance. So I know it feels like I'm giving you a lot of homework ahead of your visit day, but it's really, once you break it down, you do a little research via Google on each of these folks, the information is all pretty public, who they are and what they stand for. Thank goodness for the internet. This was much harder pre-internet. So we've done all our homework. We've built our teams. We put local people on the teams. We picked our 3 messages. We're ready to go. We've reached out through their schedulers. We've gotten either the legislator or the staff for a few minutes. Especially for folks who've never done this before, this can be a really nerve-wracking experience. But what do you do once you're in there? So I've done a little checklist. Introduce yourself, give context to why you're there, be positive and polite, be flexible. There's a good chance they might juggle you around in terms of time, even if you have other visits to get to. You know, you can say that, but you also have to not take it personally if they move the schedule around. There's a lot of demands on their time. You'll notice I'm saying here again to be specific tied to their district. Personal anecdotes are also helpful. Some of the most impactful visits I've ever had have been with people who said, I had an experience and it wasn't a good one and it can get better and this is why I think it can get better. That sort of conversation can be really, really helpful. The 3 things I think that people don't do that I think are important, I actually have here at the end. Number 1, ask how you can help them. How can we help your office? How can we be a resource? Is there something you'd like more information on? We're happy to follow up. It is astonishing to me how many people over the years have visited with me, talked at me, not asked for any kind of follow-up, and then also not said thank you. It's absolutely stunning to me the number of people who don't say thank you. And then leave behind. Now, I know there are people that are enamored of white papers. I am not enamored of white papers. Legislators do not read white papers. Do not take anything into an office that is longer than a page. Don't do it. Now, if you mention a study or something, and they say, hey, I'd like to see a copy of that study, we're interested in that topic, great. You do that as a follow-up. But handing them a giant stack of paper, a giant stack of whatever, I promise you, most of it goes in a file and they never look at it again. But if you give them something that's condensed, 3 months later, they've got a health IT bill. Oh, didn't some people come visit with us about telemedicine? Do we have that in our Health and Human file? Oh, there's the 1-pager. Says these 3 things are important. And look, that was people from our district. Short, impactful, leave behind. So if you want to do like branded stuff is okay, like a folder that says HIMSS and business cards and all that sort of thing, but the topical stuff needs to be condensed. I like to call it short attention span theater. They just don't have time to digest a bunch of information. You have to help them by making sure the visit is on point and making sure the leave behind aligns with the visit. So this is another thing that's important. You need to make sure that your talking points and your leave behind say the same thing. And I have seen that happen where they didn't. And then you left behind like a dissonant message. You don't want that. All right, now my favorite part. what to not do. All of this is drawn from my personal experience. Number one, don't be closed-minded. We are in an extraordinarily polarizing political time. And I do not have any illusion that you guys are going to have Democrats visiting Republicans or Republicans visiting Democrats. If some of your HIMSS folks are genuinely uncomfortable visiting with members of the other party, you should respect that. But you need to keep in mind that what that does is it just perpetuates the divide and the closed-mindedness problem that we already have. So when you're going into an office where you know, oh, this is a person that doesn't like technology, and we got some of those. You need to be the open-minded one, and you need to be focused on persuading and customizing the message. I
crash till Thursday.
You sure?
Say that again? Say that again? I couldn't tell if that was a question or not.
Might have been an accident.
Okay. So it is important to understand that whether you agree with these people or not, they've been elected to represent their constituents. And their constituents might not believe what you believe, but they still have to represent their constituents. So this is sort of classic civics stuff. Don't confuse opinions with voting records. Very important. I've already talked about that a little bit. Don't be argumentative or confrontational. I will tell you that there are some legislators and some staffers who live to push buttons. They're going to challenge you. They're going to push you. They're going to say things like, well, all this health ID stuff is great, but what happens when the Russians drop an electromagnetic pulse on the United States and we have no electricity? That's how, I've had that question.
So what's your answer?
My answer is usually, we train our healthcare professionals to function in the dark, in the light, with the power, without the power. What we do to treat patients doesn't change. Health IT can make it better, but our professionals are trained to adapt to a situation like a hurricane or something where there isn't any power. That's usually what I say.
Perfect.
But they don't really care. They don't really care about an EMP pulse. They're trying to get you a little bit, and that's a minority of people. But there is some of that. So you have to sort of think about when you're representing our industry, people kind of have this misnomer that we're all about technology. We are, but what we really are is technology to support our healthcare providers. So a good fallback position is always, we want our healthcare providers to have all the tools they need, but we also know when the chips are down that we've trained these people to perform under difficult circumstances. So it doesn't mean that care stops. Right? That's sort of a straw man argument. Don't be overly technical. Watch your acronyms. Watch your acronyms in your messaging, in your one-pagers, in your conversations. I would say that HIPAA is probably the one acronym that people recognize, and that's about it. The legislators don't always know the difference between Medicaid and Medicare. They don't always know what CMS is, especially if they're new. So that's one thing. And then the other place where I think people get lost on being overly technical is there's a difference between sort of what you can do and what you should do. And what I mean by that is we talk about things like data sharing. Data sharing is a scary space for legislators because of the things that can go wrong. So while, yes, technically you don't need patient consent for treatment purposes, it is always good to have conversations about consent. And consent's a really important bedrock component of HIPAA. So I had a colleague recently who went down in the weeds about, well, technically to share this data, we don't need consent because it's for treatment purposes, but they did it in such a way that gave the elected official the impression that data sharing was a free-for-all with no rules. So while it technically may be true, we all know that best practices have to do with engaging patients and making sure that we're documenting and all that good stuff. So don't be overly technical or lawyerly. Most of them are not lawyers. Most of the staffers are not lawyers. So you need to do sort of a kitchen table test. I like to talk to my mom. Seriously, my mom's really smart. So sometimes she'll ask me what I'm working on at work, and I'll pitch something. And if I can get her to understand what I'm doing and what I'm asking for, then I feel pretty good about talking to staffers and members that are not healthcare experts. So think about, using some folks to bouncing this off of each other. You all are subject matter experts, but double check that messaging. Don't get bogged down in technical stuff and jargon. Watch the time. I always recommend that someone on the visit team be the timekeeper, so that they don't have to cut you off. You cut you off. Like if you've gotten a 15-minute visit at 12 minutes, say, oh my goodness, we're at 12 minutes. Let us wrap this up because we want to respect your time. Don't make threats. Y'all would never, of course, but saying, well, we won't vote for you in the next election, or this is why nobody likes you. That's for professionals. That is not for advocacy. And if you need to remind folks that if an exchange gets heated, it's the visiting people's job to pull back and pull down, not to engage. It doesn't gain you anything, and you might have somebody who's having a bad day, or they're just feeling belligerent, or they couldn't get their mom's record from the hospital. So this is what you're going to hear. You're going to get their anecdotes, and this is where you have to really be sort of a little bit mentally prepared to say, oh my gosh, that's terrible. Surely we can make that better. We would like to see, people not live through what you lived through again. If they get belligerent or emotional because they've had a bad experience, you sort of have to take a neutral, non-engagement stance and show some sympathy. Letting them pull you into that emotional push-pull, and I have seen that happen in visits, doesn't gain anybody anything. It certainly doesn't help him. You have to be a little bit rational, and you have to be a little bit empathetic, and oh my gosh, that's terrible. Listen. That shouldn't happen. Show some empathy, but don't let them pull you into if they're having a bad day, do not let them pull you into their emotional maelstrom. And don't talk about voting or, oh, we're going to get people to vote against you or whatever. That doesn't belong in an advocacy conversation. Don't cry. I can't believe I have to say this, but I have lost track of the number of people who have cried in my office during a visit with me. The worst one was nursing home administrators when they couldn't get a fee increase, and they just started all crying and telling me old people were going to die. Oh, also don't say people are going to die. Don't cry and don't say people are going to die, because I will tell you that everybody does this, particularly in health and humans. If we don't do immunizations, people will die, and if we don't do Medicaid expansion, people will die, and if we don't fund nursing homes, people will die, and it just becomes white noise. So emotional appeals at that level are rarely successful. Facts are good. Personalization to the district is good. Appeals to emotion. They just get inundated, and it just all becomes noise. Every once in a while, I've seen somebody with a super effective story about a child that died in foster care or whatever. I can move some needles, but you are making a visit and they're doing 100 visits. So emotion, whether it's anger, tears, whatever, frankly, it's unprofessional. And part of what you're doing in your visit is you are showing up as a health IT professional in your professional capacity, talking about our profession and why we're awesome. So don't let them pull you down these trails, and don't let sort of the heat of our current political atmosphere pull you down these trails. Focus. You've got 3 talking points. You're going to get through your talking points, and you're going to set yourself up for the fun part. So what should I not do is the not fun part. Oh, yeah, there's no crying in baseball. I love that. There's no crying at Capitol either. Not helpful. What is helpful is good follow-up. And again, this is a place where lots of people drop the ball. Say thank you for the visit in writing. I have kept every written thank you note I've ever gotten in a file. I refer back to them. They make me feel good when I'm having a bad day. It helps me to remember the visit. It sort of cements it in my mind. Handwritten thank you notes are awesome. Emailing follow-up, especially if you've had a conversation about follow-up, is good. But again, no 20-page white papers. They're not going to read them. Links to articles is good, links to stories, links to, something on the CMS website, all of that is fine. If you promise to follow up, make sure you follow up. If they ask, hey, I'd like more information on remote patient monitoring, make a note of that and make sure that you do it. And then the other piece of follow-up that I'm a big believer in is having sort of a call plan with legislators that matter on your topic. So this is particularly important with committees. Now, when you guys go, we may not have House committees. In fact, we may not have the same Senate committees. But if there's a particularly hot topic, let's say that the HIMSS chapters decide that the prescription drug monitoring program is going to be a hot topic for y'all for session. When there's a vote and you visited with a member and they voted your way, it's a good way to say thank you. So when I do visits at the beginning of the year, particularly with new legislators or new committee members, and I talk to them about something like telemedicine, and then we have a vote either in committee or on the floor, I go back. Now I'm down there all the time, so it's easy for me to go back and high-five the legislator, high-five the staffer. Thank you so much for your vote in committee on that bill. It was so great that it was unanimous, and we can't wait to take it to the floor. We appreciate your support. It shows that you're paying attention, and it shows that you want to be sort of a continuing resource. So folks that are trained in sales know what a call plan is. Any organization that really wants to be successful in health and human at the Capitol has to have a system for tracking the legislators that matter, which is the committees, the 2 jurisdictional committees, Senate Health and Human and House Public Health, and tracking those members and building relationships with those members. And some of the best way to do that is to connect with the staff and then just do regular touch bases like, hey, Susan, we visited 3 weeks ago and you were super interested in the opioid crisis, and CMS just put out some new guidance. Wasn't sure if you'd seen it, thought you'd like a copy. Let me know if you have questions. Little touch points, little touch points. And you don't have to do that with all 200 plus people. You really, after you do your Hill Day, as we're tracking the session, that's when you're looking to see, oh, Jane and John and Sarah had a great visit with Representative Jones, who's now on public health, and we're just going to kind of periodically touch in with his staff. That's effective sort of grassroots stuff, is building those relationships, not being in there every day, not even being in there every week. You don't have to send them cookies. But what is not always helpful is to show up once and go away and never be heard from again. I don't believe that's effective. So some of the decisions y'all have to make as a team is what kind of advocates do you want to be? How do you want to be effective? How are you going to make that work? And is some of that going to be sort of building relationships with those jurisdictional committees that matter? So when there is a controversy or there is a big vote or there is a bill that's stuck, you can lean in a little bit. And how much of that you want to do as a group and how much of that HIMSS wants to do in Texas as an organization is up to y'all. But building those connections is what sort of helps make all of that happen. And then you have to pay attention. And that's where I come in, because I'm way down in the weeds and I'll be sending you lots and lots of information after your visits are over. And there may actually even be times when having some input from you guys might be helpful with some of these tips, particularly if you have a good visit. Like if you really felt like a staffer or a member really connected with HIMSS and the topics, that's something that's good for everybody to know, because we'll want to continue to sort of carefully and not annoyingly nurture and feed that relationship. So those are my tips, and I'm going to stop, and I'm happy to take any and all questions that you guys may have about organizing the day, what to do when you're there, the messaging, what it's like to do these visits. Any question that's relevant is fair game. And after today too. So if you don't get to it today, we can get to it later. Question?
Hey, Nora. Go ahead.
Have a question?
Well, Nora, I'm looking forward to just tracking whatever, because our 3 asks are going to be related to the opioid crisis. which of course is going to include the PDMP in there. We're also going to talk about virtual health, actually getting funding for the tele-NICU bill that Representative Ford Price had pushed through.
Yes, that's a big one.
You know, and I got to meet him at the Healthier Texas Summit. He's pretty amazing. He's learning. He's really learning more about e-health and things like that. He himself went and visited and saw how tele-neuro works, how that NeuroDoc can actually read the prescription bottle way back in the corner because they have amazing scopes on those machines. But to support what you said, he said, talk to us in the interim session. Talk to our staffers. You do not have to talk to us. We rely heavy on our staffers. So he was, he pretty much, you supported what he told us in that session.
He is marvelous. Yeah, he's a marvelous legislator. If we had more like him, my job would be a whole lot easier.
Because he gets it. He wants to learn. He's hungry for the information. Oh, and I forgot.
Yeah, I never get out of a visit with him, and I never get out of a visit with him in less than an hour. It just always seems like every time I go in to see him, there's so much to talk about, and he's so curious, genuinely curious about, well, how does this work, and what does this mean, and how do we make this work? He's thoughtful, and he's got a rural district. So I think he really understands that health IT, without health IT, his district's going to be in really poor shape in accessing a lot of resources and things that they need to keep his constituents healthy. So this is the kind of guy that when I talk about personalization, this is a guy from West Texas. He cares about broadband. He cares about mental health access. He's very concerned about those things. And so those are messages that will resonate not just with him, but with any of the legislators in the West Texas delegation.
Now, he's representative for Lubbock, but from Amarillo, or do I have that back?
Yeah. Amarillo.
Okay. Amarillo. Okay.
Amarillo.
Yeah. So with that, because doubtfully we'll have anybody from Amarillo available to talk to him, what would you recommend?
So, I think let me add a caveat. Until the new speaker, and we just found out yesterday, we think we know who the new speaker is going to be, which is Dennis Bonin from Angleton. Chairman Price was actually running for House Speaker, and he has withdrawn and thrown his support behind another member. I would send your officers to the chairman's officers. So I'm going to make an exception to my make it personal rule. And we won't have new chairmen probably by the time y'all do your visit. So that means that right now, Chairman Price he's the incumbent chairman of the Public Health Committee. I would send to him and to Dr. Schwartner, unless Dr. Schwartner disappears between now and then, I would send your leadership team, because those are the leadership offices for Health and Human Services in the House and the Senate. Now with Schwartner, it's a little easier. He's from Georgetown, so if you can put a local person on the team, that's good. But the chairmen have a bigger jurisdiction, because they have to manage sort of all the interests and all the bills that come through their committees. So if you don't have anybody local to send to the two chairman's officers, I would send your officers. I would send your senior people that are involved in leading your chapters and leading your advocacy.
Thank you.
Nora?
I was able to connect because I grew up in Amarillo, so I was able to talk to him.
Love it. That's awesome. Yeah, he's fantastic. Another question?
Yeah, hey, Nora, this was good. I appreciate it. What are we able to go ahead and schedule our visits now, or do we need to wait for a time frame, or
So
how does
their
that
staff are
work?
working now. Their staff are working now. Bill filing started yesterday. So even though we're not in session, there's somebody working in every single one of those offices.
Okay,
And
thank you.
you can either email, they have generic email addresses, or you can call the office and ask for the scheduler. Because every office has a scheduler whose job it is to keep the calendar. And you're not bothering them. That's their job. So yes, you can get started now. Understanding that with this much time in between, again, you'll need to have some flexibility. But I wouldn't wait. I mean, as soon as you guys kind of figure out what day it's going to be, start figuring out who's going to go where, and the sooner you can start booking visits, the better off you'll be. Yeah, we're all working. I'm working full time starting yesterday until June 1st of next year. It is on.
Guess we need to get busy, Elsie.
Yeah.
You do have some time, because here's the thing: you can book your visit without having done all this other homework I'm giving you.
Yeah.
But you got to figure out who your volunteers are. You got to figure out if you got people in people's districts. I don't think it's necessary for you guys, but there is actually another lobbyist who works for the Nurses Association who has developed a software package just to help people handle their visit days, because of all the coordinating that's involved, especially when you have, thousands of people showing up, and that does happen. Y'all are probably small enough to manage it manually.
We have a database that we use, so I think we'll use that again.
There you go. There you go.
And another question is, can we use these slides to go ahead and train people when we start having our training sessions?
Absolutely.
Perfect.
I mean, you can use this recording. You can use my slides. If you want me to do something for the volunteers in advance, whatever it is you guys, because here's the thing. Y'all having a successful visit day helps me when it's April and we're down in the weeds and we're fighting, and I'm talking to a staffer that maybe I haven't spent a lot of time with. If they had a good experience with y'all in January, it helps the greater cause, right?
So maybe we could provide you a post-Hill Day summary of our visit by
that would
person.
also be fantastic. Yes, because primarily what I heard last time was just the ones that didn't go well. And, well, that's fine. I also, if you met a young staffer that's really interested in helping human and seemed really into this stuff, and you can tell, it takes less than 2 minutes to tell, that helps me. That helps me also. So, y'all's success is my success. We're sort of in this together. So anything I can do to help y'all have a good visit day, I am happy to do.
Awesome. Thank you, Nora.
Yeah. You betcha.
I feel like we just put a super cape on all of us today.
Well, just remember, too, these are people. They're just people. The staffers are like 22, 24, 25. We have a lot of members that are in their first, second, or third term. They don't know, and they don't know what they don't know. And so taking a good tone, having a positive visit, being specific, all of those things, it pays dividends. It really, really does. Not immediate dividends that you can see, but all of this stuff is a long game, right? And for folks like us that are sort of fighting for the future and fighting to change the way we do healthcare, we're up against a lot of opposition of just people who like things the way they are, or they don't like EHRs because the last time they saw their doctor did not. This is probably the most frequent complaint. So y'all need to be thinking about your talking point for this. I can't tell you how many legislators, either in committee or in other settings, have said to me, well, Nora, I really hate these EHRs. I went to see my doctor the other day and they did not look at me one time. They spent the entire time typing into their computer.
But what do we do?
So, when I'm in public, so I've been asked this when I've been testifying, I think I said something like, wow, Representative King, that is really unfortunate because the EHR is supposed to support the doctor-patient relationship, not replace it. Privately, what I generally tell them is, your doctor didn't go to training, because we would never train a doctor to do that. That's a doctor that's trying to fit the EHR into their workflow rather than integrating it. Does that make sense? We all know doctors are terrible about not going to training. We know this. So if you're not trained, of course you're glued to the screen because you don't know where to go and you don't know what to do.
It's not intuitive to them yet.
We
can just speak to that that it's a process, that it's a learning process.
That it's a process. Right.
Yeah.
So generally my public answer is the EHR is supposed to support the relationship, not replace it. In private, depending on, as long as I'm not talking to a doctor, I have been known to say, that is probably a lack of training. Because we would never, no EHR vendor or implementation team would train their doctors to never look at their patients.
Right.
You have to be careful with that one, because even though it's true, it's not a very popular answer.
Especially to Dr. Schwartner, Senator.
Especially for Dr. Schwartner, although we were joking the other day, we were going to buy him a little T-Rex doll with his tiny little arms and a fax machine, like a toy fax machine, and put it on his desk.
Just so you feel comfortable.
Two things that are going extinct.
Yeah, a pager. Put a pager on there.
A pager. Hey, look, my husband just got a brand new pager at the hospital where he works. I cannot believe we're still in a world where there are pagers.
Yeah. Okay.
Got to do what we got to do. Any other questions? I want to be sensitive to everybody's time.
Well, we'll have this posted soon.
Awesome.
Yeah. Yeah. I'll chime in with Doug. Thank you so much. So we'll post this on a link to Austin HIMSS, and I'll share with the other 4 chapters in Texas as well. And I'll get the slides from you, Nora, so that we could kind of use those as our foundation for training our advocates for this coming session.
Okay. And then let me know what else you need. I'm happy to partner with you.
Thank you so much, Nora. We really appreciate this. This has been really helpful. It's put a very solid, filled in all the gaps that I personally had for advocacy. You know, I've only done it once, and I loved it. But this is even more solid than the information I got from my experience. Thank you so much.
You're welcome. I'm happy to do it.
Any last words?
Feel free to follow up with me. Anything else you need.
Thank you, Nora. Appreciate you
Nora.
guys. Everybody
Thanks,
have a great week.
Thank you.